Ladies and gentlemen, as long as we will continue talking about data storytelling in medical affairs and healthcare, let me start by telling you another real story. Years ago, I was invited to give a lecture about sildenafil citrate, which is Viagra, to a women association, a non-medical association of women in one of the most conservative countries in the world at that time. Before the event, and when I was trying to learn more about my audience, my colleague who organized the event gave me multiple warnings. Be careful, he said. They are very conservative. Choose your words wisely. The topic could easily irritate the audience. So I asked him, half curious and half anxious, if they are at that level of conservativeness, why are they even interested in this topic? He explained that they were invited by the head of a major university in the country. They didn't choose to attend, and they simply wanted to know about the new medication, by that time of course, and its interactions with cardiovascular medications. To be honest, his words made me feel uncomfortable. I felt that I was walking into a cultural minefield. I knew if I explained the topic the usual way, my way, openly and scientifically, it might cause discomfort. So, do you know what I did? I decided to present only science and data. No metaphors, no human context, no stories, just facts, graphs, and some mechanisms of action. And yes, everything went smoothly, no one seemed offended, the lecture ended peacefully, and I went home relieved. But here is the truth. I also knew that my message didn't land. The audience left happy without really understanding the value behind the science, without understanding the meaning behind the data. The data stayed in the slides. It never reached their minds or hearts. I knew this. What can we learn from this story that happened years ago? One, and as we discussed the last time, data alone can inform someone, but it rarely connects. And when we remove emotion, context, people may hear the information, yes, but not to feel its relevance. That's why storytelling bridges the understanding. Even in sensitive or conservative contexts, there are always ways to use empathy, relatable examples, or metaphors that respect culture while still making meaningful messages. The second learning, I think, that knowing your audience is not about avoiding topics, it's about finding the right language. The best communicators adapt their message so that it's both respectful and resonant. And I think what I learned also, that the scientific accuracy and storytelling are not opposites. They are partners. While data build credibility, stories build connection. And both are needed, actually. Both are needed to make the impact. Now, let's take a moment to define what we actually mean by data storytelling in healthcare and medical affairs. Data storytelling is the art and science of transforming complex medical data into a clear, meaningful, and emotionally engaging message. A message that can inspire understanding, connection, and action. In simpler words, it is not about showing more data or how complex the data is. It's about really showing the right data in the right way to the right audience. In healthcare and medical affairs, this means taking clinical relevance, survival curves, adverse events, real-world outcomes, health economic data, and transforming them into a narrative that explains what these numbers mean for patients or for the healthcare providers or for the business, depending on our audience. Data storytelling turns cold statistics into human stories. Simply like that. It bridges the gap between scientific facts and strategic decision making. There are 4 components for any story or for any data story. And these 4 key components are components of effective stories in healthcare and medical affairs. 1, the data. The data is the foundation of credibility, and in medical, everything begins with accurate, validated, and relevant data. In medical affairs, this can come from clinical trials, real-world evidence, patients' reported outcomes, surveys, or even from the key opinion leader insights. The data provides the what, but remember, data alone doesn't move people, doesn't inspire others, it only informs. The story is the second component, and this is the bridge between facts and emotions. This is where we give meaning to numbers. The story answers the question, why does this matter? For example, instead of saying, this treatment improves progression-free survival by 24%, you might say, this treatment helps patients spend more months living their lives without their cancer progressing, like what we discussed in the first episode. So the data is the same, but now it resonates. And don't worry, in this episode we will share 10 more examples like this in order to practice different scenarios. The third component in data or in effective data storytelling are the visuals. And this is the language of the modern world. Visuals bring your data and story to life. Whether charts, infographics, dashboards, they make the complex data easy to digest. But take care, in healthcare, the goal is not to decorate, it is to clarify. So a simple, well-designed graph can make a stronger impact than 10 bullet points. The last component, and probably the most important, is the audience. It is the heart of your message. As a learning from the story I shared in the beginning, the most powerful story means nothing if it is not understood by the audience. In healthcare, your audience can range from regulators, payers, to clinicians, patients, business leaders in the internal stakeholders category. Each one of these has a different lens. And our role in medical affairs and healthcare is to tailor our message so that every audience can see the same truth, but from their perspective. When these 4 elements come together, data, storytelling, data, story, visuals, and audience, when they come together, that's when communication becomes influence, and that's the true power of data storytelling in healthcare. Turning information into insight and then turning insight into action. Now, let's put this into action and practice how to transform data into stories. And yes, this is a skill that needs repetition until it becomes second nature, so that you can speak your data as a story anytime you need so. So I will share with you now 10 examples, and then I will put this into a chart so you can refer to them at any time and probably draft your own stories from your real data in your work. So let's start. For example, instead of saying this treatment improves the overall response rate by 40%, you can say it as a story. 4 out of 10 patients now responded to treatment who previously had no effective options. Do you notice how we brought the value and the patient context into the narrative. The science is the same, but now it's more human and it can really inspire someone to take action or to make action. Another example, instead of saying our vaccine reduced the hospitalization rate by 60%, you might say for every 10 people who could have been hospitalized, 6 are now staying home and recovering safely. Another example, instead of saying adherence improved by 25%, you might say 1 in 4 more patients are now taking their medications consistently, leading to better outcomes and fewer relapses. Another example, instead of saying the therapy lowers hemoglobin A1C by 1.5%, you might say patients using this medication are bringing their blood sugar closer to healthy levels, reducing long-term risk of complications. Notice here how we added the value and meaning of the data by reminding also of the complications of not being adherent. Another example, instead of saying these diagnostic tools detects cancer at stage 1 in 70% of cases, you might say 7 out of 10 patients can now discover their cancer early enough for a real chance at cure. Another one, instead of saying the intervention reduced readmission rates by 18%, you might say fewer patients are returning to the hospital, meaning more time spent at home with their families, and so on. Let's have another example. Instead of saying this drug decreased disease progression by 30%, you might say patients can now live longer before their disease worsens, gaining more quality life and more quality time with their loved ones. Instead of saying our program improved the treatment initiation by 40%, you might say nearly half more patients are now starting the right therapy on time, giving them a stronger start in their recovery. Instead of saying the new device reduced procedure time by 20 minutes, you might say each surgery now finishes 20 minutes sooner, allowing doctors to treat more patients every day. Instead of saying the app improved patient engagement scores by 35%, say patients are 35% more likely to actively manage their health through daily use of the app. And this turns data into healthier habits. Instead of saying drug A reduced cholesterol by 15% more than drug B, this is a comparative one, you might say patients taking drug A achieved healthier cholesterol level faster and more effectively than those who were on drug B, giving them a strong protection against future heart attacks and strokes. Instead of saying our new medication reduced psoriasis severity scores by 40%, you might say patients using our new cream or our new medication saw clearer skin and less itching from the psoriatic lesions, allowing them to feel more confident, wear short sleeves again, and enjoy everyday activities without discomfort. In all the previous examples, you can see that the science has not changed. The core of the data has not changed, but the story brought patients' experience, avoiding side effects, adverse events, complications, and brought the value and the meaning of this data. So next time you talk to a non-medical person, whether a leader in your organization or a patient, always link the value and the meaning to the data. Let's stop here and leave you to practice more examples. As I mentioned, I will attach this to the description of this episode, and you can write your own real examples from your own therapeutic area or your own work. In our next episode, we will see how we can turn an ordinary email message about an achievement in medical affairs into a compliant narrative that can inspire our leadership not only to reply, but to make the right decisions. And we will also get some practical compliant examples about how to use the SPAR model. Till then, have a great day, see you soon, and thank you.